Hi, my name is Beth Gaddis, and I'm the Vice President of Marketing at Patient Prism, and I'm joined on set today with Janet Hagerman. Janet, it's a pleasure to have you here today.
Thank you, Beth.
Janet and I go way back. We worked together at a DSO where you were the Director of Dental Hygiene.
Mm-hmm.
You have actually been clinical for 20 years. You have been a dental coach for 15 years. You have written a book called Selling Dentistry Ethically, Eloquently, and Effectively. And you speak all around the country on this topic.
Mm-hmm.
So it's a pleasure to have you here today.
Thank you. Thank you.
One of the things that you talk about, which I had never heard of before, is a treatment triad. Can you go ahead and explain what that is?
Absolutely. It's one of my favorite strategies. It was actually inspired by my neighbor who had put dentistry off and ended up in serious trouble and ended up changing dentists just because they hadn't done some simple things. So here's the thing. Dentistry can be overwhelming, and one of the things I think dentists and even teams hate to hear and are afraid to hear is if we tell the patient all the things that are wrong with them and we give them a really full, complete treatment plan of diagnose everything at once, they're going to be overwhelmed.
Right.
And say something like, how come my last dentist didn't find all this? I mean, that's pretty typical. So how do we present treatment, comprehensive treatment? So that's restorative treatment, hard tissue, soft tissue, the perio, oral cancer, all of that, not to mention cosmetic dentistry, in a way that doesn't overwhelm the patient. So our goal is to go from, oh my gosh, nobody ever told me I needed all that before, you must need a new car, to, oh my gosh, that was the most thorough exam I've ever had.
And I feel well cared for.
Absolutely. So what we do is the secret is prioritization. And I call it the treatment triad because it's got three components, but also because I've had teams tell me we've tripled our case acceptance since we started using this system. So it works well. So this is what it sounds like. It's got three pieces: urgent care, preventive care, and cosmetic care. Okay. So as the patient's in the chair and you're doing an evaluation, the conversation is something like, all right, Mrs. Jones, today we're going to be looking for three types of things. Urgent, 911, that has to be done. And of course, you already knew that you broke that molar up in the upper right. So we're going to look for urgent care, things that we can't wait. But I'm also going to be looking at preventive treatment that we can do that will keep you from needing urgent care. Some of this we might want to do in the next couple of weeks. Some of it we might be able to do, you can help us decide that, all right? And then finally, we're going to look at cosmetic work. Just like you said, you wanted your teeth whitened or you want to close that space. But this is something that's totally not necessary, but fun to look at. Right. So now your patient says, okay, this is what I absolutely need. There's some wiggle room here, and this is totally optional. So it's a completely different feeling for the patient than here's a $4,000 treatment plan when I just came in to get my teeth cleaned and for a checkup.
I love this because it really moves them into being enlightened about their health instead of feeling overwhelmed by what they've been told they need.
Absolutely. And not just overwhelmed, but new studies are showing that patients want to be involved. They want to feel like they're involved in and that there's some sort of a plan, but they want to be a part of that. So this helps the patient be in the decision-making process of how do you want to segue this out according to your budget. But the beauty of it is that you get started. You plant the seeds, you get started. The patient always leaves with an appointment. Even if we're moving along the treatment plan in baby steps, we never stop. And then the final thing that's beautiful about this is a blueprint for the rest of the team. So if you're the hygienist and the patient comes in, you can look at that treatment plan and say, I see that doctor has planned XYZ for you. Let's talk about where we are in this process. So the rest of the team can keep it moving along.
I love that. I mean, the treatment triad concept is so simple, but it's so effective.
Yeah.
And I'm sure that it makes a huge difference in elevating the amount of case acceptance that dental practices receive.
Absolutely. I typically get at least 20 to 30% increase in case acceptance just by using this strategy, the open-ended question strategy that we've talked about in other segments as well, and some of the other strategies that I teach in my book and my classes.
And in addition to the segments you've done with Patient Prism, you've also done a mini-series that's on your own website. Can you tell people how to find that?
Yeah, www.sellthatsmile.com.
Janet, thanks so much for joining me today. I really appreciate it.
Thank you, Beth.